Hello, everyone, and welcome to today's webinar. Today's topic is From Forms to Finances, Practical Tips for a Stress-Free Start. We all like that, stress-free starts. My name is Mikkel St. Germain. I am the Director of Parent and Family Engagement here at Brown University, and I'm happy to welcome you all to today's webinar. We're so glad that you're joining us. It is a kind of cloudy day in Providence here, but we're expecting some sun and summer to be here soon. So we are getting the campus ready for you. And I have just a little bit of housekeeping to talk to you about before we get started with my wonderful colleagues who we have on the panel today. Right now, we have about 150 people who've already signed on, and the number keeps going up. Many of you submitted your questions in advance of today's webinar, and we did our best to incorporate that into our presentation. However, if while we're going through this, you get some other questions in mind, please feel free to submit that to us using the Q&A tool at the bottom of your screen, and we will try and get to as many of those as possible after the presentations. We also have a captioner with us today who's typing live captions, so if you do need that, please click on the CC button at the bottom of the page and you'll be able to get closed captions. Many of you have written to ask where you can access the recording of last week's webinar, Living at Brown, which talked about everything to do with residential life. And that webinar is posted in the same location where you registered. So if you go to the webinar page of the Parent and Family Webinar website, you will be able to click a drop down and see that video of that webinar, and then and this one in just a few days, and any others coming up that you may not be able to attend. And those will be up all summer for reference should you need them. I also want to call your attention to 3 webinars happening next week. Next week's a busy week. On Monday morning, Brown time, we will have a webinar specifically for international families that will address questions you may specifically have about your student coming to us here at Brown. And then on Tuesday, we have a follow-up session that's a companion piece to today's webinar, which will talk a little bit more in detail about the health insurance plan. And we'll get to that in just a little bit. And then finally, on Wednesday of next week, we have our Dining at Brown webinar, which includes my colleagues from Dining Services, and we'll talk about meal plans, special diets, and everything about eating here on campus for your student. So now that we've gotten through that, I would like to introduce my panelists. And we have with us today, let me get to our list of fantastic panelists. Kirsten Connors, who is the Director of Student Financial Services and University Bursar. And then Melanie Neves, who is Director of Undergraduate Financial Aid. And finally, Erica Larange, who's the Assistant Director of Student Health Insurance Operations. So let's get started. Kirsten, would you like to start the presentation?
Thank you, Mikkel. I'm Kirsten Connors, the Director of Student Financial Services here at Brown. Our team is responsible for the student account billing, collection of student accounts, and the management of federal and institutional loans. We work to help families navigate different finance options and figure out their payment options. So on our website, you'll find some resources that we have put together specifically for new students and families of new students. If you go out to brown.edu SFS, you'll find our new students page where we go through a lot of financial information that will help you to get acquainted with Brown's systems, Brown's policies, anything related to how to access the student account, how to make payment, how to understand the charges and the credits that you're seeing. So we try to provide a lot of information for you on that page. In addition, earlier today, our team sent out an email to all incoming new students, which really provides a lot of the same information. So if you're connecting with your student, please encourage them to share that email with you. You'll find a lot of helpful information there. Next slide, please. Also today, we made available the billing for the fall semester. So any student and any authorized user would have received a direct email notification letting them know that the fall billing statement is available online. All of our billing is done electronically, so we don't offer any paper billing statements. You will need to go out online to our student account payment system in order to see your fall bill, see your charges, and be able to make payment. The deadline for the fall charges is August 1st, so that is when payment is due. And we do offer an optional installment payment plan if you would like to split up your fall payment over a number of months. The deadline to enroll in that plan is on August 2nd. And then just for reference, I mapped out some of the dates related to spring billing. And so you can see here that the bills for the spring will be available in late November, and then payment is due on January 1st. Next slide, please. Thank you. I wanted to share a screenshot of what our student account payment system looks like. So students will automatically have access to this system, and this is where they can go out and they can see their charges, they can see their student account statement, they can manage, excuse me, they can manage their profile. So they can do things like adding authorized users, which would then allow family members to log on to this account and see the same information. They can set up things like electronic refunds. So if there's a credit balance on their student account, they can designate where that credit balance should be sent, and we can send it electronically to a bank account. You can see the red arrow that is to the bottom of the screen points to where the statement is located. The red arrow above that points to a button called View Activity. So the billing statement that was presented today will include anything that has posted to the student account as of today. If there are any adjustments to the student account that happen after that billing statement is created, you would see it under the View Activities section. Okay. Next slide, please. So just a little bit more detail about student account payments. Payment can be made online through the student account payment system, which we just looked at the screenshot. Your options for making payment include ACH, so an electronic check, debit or credit card, TransferMate for international payments, and you can use any of those in conjunction with an installment payment plan if you would like to. Options outside of making a payment through the online student account include check or Flywire. Anyone who has an expected amount coming from a scholarship, a loan, any kind of external funding, as long as Brown is aware of those funds coming in, those funds will appear as a temporary memo credit on your account, and those will reduce your balance due. If those funds are not received or paid by October 15th, that temporary memo credit is then removed from the account and your balance will change to reflect that. Next slide. So one thing that we want to make sure that families understand is that at Brown, students are our main point of communication. And most of the communication that comes out from our areas is sent by email. So if there's one takeaway that you could share with your students today, please encourage them, set up their Brown email account right away, and continue to monitor that throughout their enrollment so that they receive those important communications from all of our areas. The other takeaway that I would encourage is please talk with your student and encourage them to set you up as an authorized user so that you're able to log into their account and make payment, or you can connect with our team and ask questions. By setting you up as an authorized user, they're giving their permission for us to go into detail and speak with you about their account. And finally, our contact information is here. So if you have any questions related to student account billing or payment options, please reach out to Student Financial Services. And with that, I'm going to turn it over to my colleague, Melanie, in financial aid.
Thanks, Kirsten. Welcome, everyone. Thank you for joining us. My name again is Melanie, and I am the Director of Undergraduate Financial Aid. Some of the information that I'm going to go through right now through my series of slides is just sort of touching on some of our most common questions at this time of year as it relates to financial aid. Next slide, please. So most at this point have likely, if you're on financial aid, you've received your financial aid award, you've already done your application, back in the fall or the spring, depending on when you were admitted to the university. But these are some common questions or things that are going on at this time of year. So if the student has any sort of outstanding document requirements, that could be the case. If you don't have a financial aid award by now, but you have applied for financial aid, that's something that you would want to look into via the Banner self-service portal if we're missing anything. That's where the student would see their financial aid offer and any requirements that are needed or have been satisfied. If there are any external resources, so Kirsten touched on this a little bit as far as how those are applied to the bill, but we, for students who are on financial aid, are asked to be notified about any external resources that you might be receiving. So that would be in the form of outside scholarships, parent tuition benefits, etc. We sent out communication a couple of weeks ago with a form. It's a Google form asking students to fill that out to let us know of any scholarships they received. Or any sort of parent tuition benefits or other external resources like that that are going to be used to pay the bill outside of their own payment. And one thing to note is when you're filling out that form, because we get questions about this sometimes too, as Kirsten mentioned, make sure the student has set up their Brown email account and that they are signing into the form using their Brown email. Otherwise, they won't be able to get access to it. And then finally, as I said, if you've applied for financial aid, you've likely done that either a couple of months ago or many months ago. And we understand that there could be potential changes in your family circumstances since when you originally applied. If that's the case, we recommend contacting our office directly so that we can sort of give you guidance in terms of what makes sense at this point, which could be any number of things depending on what your situation is. But this is more so just to highlight that even though you've applied for financial aid, whether it be a couple months ago or several months ago, if there's been a change in your family circumstances since that time, then we can sort of talk you through what makes sense as far as following up with our office. Next slide, please. So student employment, this is something that we get a lot of questions about at this time of year. And as we get closer to the start of the fall, one main question, what is the difference between campus employment and federal work study? So if you have a financial aid award, you might have one of these components included in your financial aid offer. And this is a super simple, easy question to answer because the answer is nothing. There is no difference. So if you have a campus employment or federal work study, both of those are opportunities for students to work on campus. We are fortunate at Brown where whatever federal funding we receive towards federal work study just goes into our operating budget alongside our own campus employment funds that we contribute as well. And that money is sort of distributed to departments across campus. So they don't have any sense of whether a student has federal work study or campus employment. This is not the case for a lot of universities. Sometimes it is a requirement that the student has federal work study in order to be hired by a department. Like I said, we are very fortunate at Brown where that's not the case. So for your purposes as a student, even if you're not on financial aid, you're not required to have any sort of federal work study or campus employment in order to be able to work on campus. So any job that you apply to, there's no preference given to whether or not someone has federal work study or if they're on financial aid or et cetera. Everyone is treated the same, when it comes to actually looking for and applying for jobs. The minimum hourly rate at Brown as of January 1st of this year is $15 an hour. Another common question we get are how are funds paid to students? And that's just via a regular paycheck. They're paid on a biweekly basis, so it doesn't get credited to the student account. It's up to the student and the family as to whether or not they want to take their earnings and apply those to the student account. I think in most cases, anecdotally, what we found is that students are generally, whatever money they're earning from working on campus is typically used to fund whatever expenses that they have outside of their cost of attendance. And we sort of recommend in the university as a whole that students aren't working more than 8 to 12 hours per week. If you have a campus employment or federal work study component in your financial aid offer, that's representative of that. The amount that's included as a standard for every student who receives financial aid is based off of, working 8 to 12 hours per week during the academic year at a rate of at least $15 an hour. And the expectation around that is that the students are here to work on their academics, and working otherwise, working at a job is not meant to interfere with anything related to academics or personal obligations. So it's meant to be secondary to everything else. And then I have here some information about where you can find a job. So that is managed through our University Human Resources Department. And students, as they start to get more information and get access to different things, they will be given access to Workday, which is sort of our HR portal, and that's where students are able to search and find jobs. There's typically a student job fair in the early fall once everyone's back on campus. Jobs tend to be added, more jobs you'll see populated as we get closer to the start of the fall semester. So that's also something to keep in mind. But if you visit this website, which I saw Mikkel just shared out the link to that, they also do open hours. I think it's on Tuesdays and Thursdays. They have like open Zoom hours where students can go and ask questions around student employment and finding a job. Next slide, please. So I wanted to also just sort of highlight some of the other financial support that's available that, we do provide information about this on the financial aid offer, but I think it's important to highlight just in case you didn't see that or were curious about these initiatives that we have here at Brown. So we have the book and course materials support program. So any university scholarship recipient is eligible to have their book and course materials covered by Brown. More information about this program and how it works will be sent out as we get closer to the start of the school year. And that's sent out through the financial advising office, so you'll be hearing more from them. But essentially, students who have a university scholarship are able to go to the bookstore and charge any required course materials. So their professors are letting the bookstore know what materials are required for their courses. So students can go, they use their student ID, it's charged to their student account, and then a corresponding credit is applied, assuming that, again, those course materials are required for their course. And then we have the health insurance scholarship, which Erica is going to talk about after me, or the health insurance program. But this is just to sort of touch on that. Any students who have university scholarship are eligible, and who do not have comparable insurance coverage or have no insurance coverage are eligible to receive an additional scholarship beyond the scholarship they've already received to cover the cost of Brown's health insurance scholarship. And then finally, if you are interested in borrowing a loan, we do not include loans in our financial aid offers upfront. And that is one of our initiatives in the Office of Financial Aid. So students may not see that they have any financial aid, or they have any loans, but that doesn't mean that they're not eligible to borrow. So if you've completed a FAFSA, that's generally for domestic students to be able to borrow federal student loans. I recommend either emailing or reaching out to our office. You do have the option of submitting a loan request through the Banner Self-Service portal, but if you're a first-time borrower, I think it's in your best interest, students and parents, to reach out to our office and have a conversation with one of our counselors just to sort of get a sense of what that would look like. Next slide, please. And then finally, I know that this is jumping ahead a little bit. We just got just recently, you're getting your bearings in terms of financial aid and your eligibility and how that works and getting the bill. But I just wanted to highlight some important upcoming dates to be mindful of and what the process sort of looks like once you're actually reapplying for financial aid now that you're at Brown. So domestic students only would need to complete the FAFSA for next year, which would be open and available to complete as of October 1st. International students are completing the CSS profile. And then we would base next year's application on 2024 income and tax information. And in some cases, we may be reaching out and asking for students to provide that information to us. We will send reminders, of course, in October. Again, why it's very important, as Kirsten highlighted, for students to pay attention to their email, because that is our main point of communication with students. It's directly to the student, and it's up to them to share that information with their parents or caregivers. But they'll be, Banner self-service, like I said before, will have the requirements listed there. They'll be able to see we have the information on our website. It's not quite up to date yet because we're still in this, moving into this academic year, but we will start updating that soon. Renewal applications are due in early February, and awards are available for returning students typically in mid-June. We just sent those out to our current student population last Friday. So that's sort of the timeline of what students can expect when it comes to reapplying for financial aid each year, which you do have to do every year. Next slide, please. And then finally, this is our contact page. I highly recommend, if anybody has any sort of specific, more detailed questions about anything, this was a very, high level overview of some of our most common questions and concerns of this time of year. But if anyone has any specific questions that they'd like to speak to a counselor or speak to someone at our front desk, then I recommend visiting our website. And if you click on the contact us page, you'll see information about how to contact us either via phone or email. We are essentially, to speak with a counselor, we're by appointment only. And you can do that online, or you can, reach out to our office directly and speak to whomever answers the phone, and they can generally help with most surface level questions. So that is all for me. I'm going to go ahead and turn it over to Erica.
Hi, everyone. As mentioned, and you can see, my name is Erica Larange. I'm the Assistant Director of Student Health Insurance Operations. And I'd just like to start by saying welcome and congratulations to Brown. It was a big deal for all of you to get here and to get your students here. So you should be very proud of yourself and give yourself a little pat on the back. It's a big deal. So congratulations. So next slide. So I am the director of the health insurance operations, but I do like to start with bringing notice to our health and wellness center on 450 Brook Street, where my office is housed. Because the line item that you see on your bill for the health services fee of the $618, that goes towards the Health and Wellness Center. It's a mandatory fee for all students so that they can see a provider at the Health and Wellness Center. They can go there for primary care and some of their secondary care and some urgent care. And no student is ever charged to see a provider. It's that fee that covers it. That goes for the health and wellness side, but also our counseling and psychological services is housed in that building, along with pharmacy, laboratory, and x-ray. Insurance becomes involved when the student goes to the pharmacy, the lab, or receives an x-ray. The Health and Wellness Center does not accept any insurance when they see a provider, but the pharmacy and the lab will bill insurance. The student, if they receive an x-ray at the Health and Wellness Center, they will either they can pay by credit card and receive an invoice to get reimbursed, or the charges will be placed on the student's Bursar account. But we do have 10 medical doctors there. We have physician's assistants, we have nurses, medical assistants, and team assistants. So if your student was to go see a provider and they were referred to a specialist, then a specialist off campus, then they would use their insurance. And we have team assistants that help them, book the appointment, make sure that the specialist participates with your insurance plan. If they need assistance with transportation, they can assist with that. And then they can also have, if your student wants someone to go with them, like a buddy, they can arrange for that to happen as well. So it is a full-fledged health and wellness center, and we always encourage our students to call our 24/7 nursing line if they're not feeling well, or if they call 911. If the person if it's a dire emergency, of course, they're going to send the emergency there. We have Brown Emergency as well. But if they're speaking to the nurse online and they're like, I don't need an ambulance, but I'm, too sick to even come down to you, then they will send EMS up to their dorm room to check them and make sure, see if they do need to go to the emergency room or if they need to be brought to the health and wellness center. So I just like to touch upon that because a lot of people do get confused. They feel if they can't go to the health and wellness center, if they don't have the student plan. It doesn't matter whether you have the student plan or your private insurance plan. Every student pays that fee. So every student is eligible to go to the health and wellness center. All right, next page. So another confusing thing is that our insurance broker is Haler, Fryer, and Kuhn. And your students started to receive emails from them on Monday morning at 9:15. It's a take action email. And that email has all the information on how to enroll into the insurance, waive the student plan, and how to enroll in the voluntary vision and dental plans. Our student plan insurance carrier is United Healthcare Student Resources. Next slide. So this is, that picture there is just, it's the first page you'll see when you click on the health, the enrollment and waiver portal link. So the student will put their banner ID in. Actually, the email was sent on June 16th. I apologize, I didn't correct that. And the annual premium is $4,944, as you'll see on the bill. And the effective dates of the insurance are August 15th, 2025 to August 14th, 2026. So once the student fills out this page, on the next page, they'll be able to find, well, yeah, thank you. So it is a Platinum Comprehensive Affordable Care Act, I guess, compliant plan. I apologize. Lost my words there for a minute. So it does have a $300 deductible for some benefits, but not all. That $300 deductible is waived for laboratory services that are done at Brown University Health, which up until recently was Lifespan Health. And it is waived if they receive any radiology services from Rhode Island Medical Imaging. So in network, there is no coinsurance. The out-of-pocket maximum is $8,100. Physician's visit copay, a specialist is a $15 copay. Day surgery, if planned, is a $100 copay. Room and board expense is a $100 copay, and the ER room is a $100 copay. Your urgent care copay is $15, and your prescription copays are $15, $30, and $50, depending on the tier. And if anyone is interested in getting the drug formulary, you can email me. You'll see my contact information at the end of the presentation, and I can send you the drug formulary so you can research what tier the medication is for your student. There are case management, there is case management available for, God forbid your student does have a large medical episode, like a medical episode, there is case management available. And the plan does not require referrals or prior authorization. And it works nationwide, so when they are home, they can utilize the plan just as they can while they're in the state of Rhode Island. And the medical plan includes full dental and vision benefits for students under the age of 19 until the last day of the month they turn 19. So if your student is under the age of 19, it's not necessary for you to purchase the voluntary dental and vision plans. Then the plan does offer out-of-network benefits. It has a $300 deductible and a 70%, so you pay a 30% coinsurance. And for mental health, it is the $15 copay and 30% coinsurance. And the remaining benefits is their copay plus the 30%, or the insurance will pay 70% of the allowed amount. Okay, next page. So my role at Brown for your student is if your student receives financial aid, then I can help them with getting onto the insurance if they happen to lose their insurance during the year, or I can help them if they're not aided. They're on SHIP and they receive a bill that's over $300. Please have them reach out to me. I'll research to ensure that the bill is valid. If your student does not have SHIP but private insurance and receives a medical bill they do not understand and want to confirm they're paying the correct amount, they can reach out to me, or you can reach out to me and we can research to ensure that the bill is valid. As I mentioned, if your student loses their private insurance, you can have them reach out to me, or you can, and we can get them enrolled into the SHIP or for assistance in enrolling into the marketplace plan. You can, if your student sees health services, x-ray charges on their bursar account, they can reach out to me and I can guide them through the process of getting reimbursed from your insurance company, which can kind of be a complicated situation. So feel free to reach out to me on that. It's a very easy process for me to understand, so I can guide you through it very easily. If your student decides to go on leave of absence, depending on where they are in the semester when they request leave, they may continue to use the student health insurance if they're already on the plan. If a student is not on the plan, but a private plan and needs to enroll into the student plan, if eligible, they can. And there are some resources available for assistance for zero PC students on a leave of absence to help with paying the premium. And I can schedule an educational meetings to teach them how the health insurance works and how they can best take advantage of it. I schedule meetings on weekends and evenings, whichever is convenient for the student or for a parent if they have any further questions. And I educate the students by explaining their benefits and what their out-of-pocket costs will be or should have been. It's always very helpful if they see me before doctor's appointments so they can ensure they incur the least amount of out-of-pocket cost. And I can always ask them, I can always help them to research and strategize on how to get services covered. Next slide. So what does the plan include? It's a comprehensive plan, so it pretty much covers everything that is medically necessary. So there's preventive care, primary care, mental health services. But I also like to mention that at our counseling and psychological services, each student does get 6 visits with, we call it CAPS per semester at no charge. But then if they'd like to go outside of CAPS, then they could use the health insurance. It covers the immunizations, full pediatric, dental and vision, covers prescriptions, labs, ambulance, and emergency evacuation and repatriation services. And there is a Teladoc telehealth services. Next slide. And this is how you can reach me. You can use this QR code. That is my email. The QR code will go to my calendar if you'd like to set up an appointment with me, if you'd like to go discuss anything more that I've mentioned in detail. I strongly encourage you to make an appointment if you're not sure about whether you should enroll or waive. But as Mikhail had mentioned, next week we will be having another webinar that will go into the enrollment waiver process in depth. I go through each page and I demonstrate what to do on each page. And then when everybody's ready, when they've completed that page, then we go to the next page and to the next page. So I'll start with the enrollment process, which is relatively quick. And then secondly, we'll go through the waiver process. And if you'd like to get in touch with our insurance broker, you can reach them at brownstudent@haler.com. And that's all I have.
All right, thank you, everyone. We've got some great questions. So, and I know that some Melanie and Kier, you've been furiously typing some of the answers. We did get a lot of questions about 529 plans. So, Kier, do you want to just address that for the whole group?
Sure, absolutely. 529 payments can be sent directly to Brown. Those should be sent to the Brown Cashier Office, which is Box 1911, Providence, Rhode Island. However, some 529 plans have set up partnership where they're able to make a payment electronically to Brown, and we find that those get delivered more quickly and posted to the student account more quickly. So for that, you would need to check with your individual 529 plan to find out what is their preferred delivery method for their payments to schools.
Great, thank you. And then we've got a lot of insurance questions, but before we get to that, Melanie, we had a couple questions asking about what the process is next semester when they're starting to get ready for the following school year. I think you touched a little bit on that in your presentation, but if you could talk more about how they'll know when it's time for them to get back into that.
Yeah, sure. So we will send out a communication to students typically around October in the fall, which is when the FAFSA application opens. So that would be for domestic students to complete. And the CSS profile opens around that time as well, which is when international students would complete the CSS profile. We'll send an email to let you know that those forms are available, and then also detailing any other documents that we need to collect. So depends on the student and family situation, what we will be looking to collect. At the most basic, what we would want is to get at least the 2024 tax returns or wage income information. And that would also, at that time, we'll also be updating students' Banner self-service portal, so they'll be able to go in there and also see what they're missing and what they need to submit to complete their financial aid application.
Great, thank you so much, Melanie. And hello to all the Canadians. One of you asked about 529 plans, and if we could explain that a little bit more. Kier, just quickly, what is a 529 plan?
Yeah, I was just starting to type an answer to that one, so thank you for bringing it to the group. A 529 plan is a college savings plan. So it's a way for families to set aside money that goes into a 529 account to be used for educational expenses in college.
Great, thank you. Erica, are you ready for a lot of health insurance questions?
I am. I just got some water for myself. I'm good to go.
Okay, all right. So a lot about the waiver. Should everybody who's on financial aid apply for the financial aid waiver or for the health insurance waiver?
Yes, I would recommend that. Yes.
Okay. And can you talk about do students who are on private insurance still have access to the 24/7 nurse line and other phone services?
Yes, even you don't need to have the student plan in order to get access to the Health and Wellness Center. That is covered by the mandatory health services fee on your bill for $618 per semester.
All right. And this one, I'm not sure if this is appropriate for you, Erica. If not, we can forward this to health services. But do you know that if they can have their prescriptions filled on campus from a home doctor?
Yes, they can. You can do it two ways. You can have your home doctor send the prescription to the Brown pharmacy, or you can have your pharmacy at home transfer it to Brown, or once they get here, you can ask Brown to transfer it from your home pharmacy. So you have a few options there.
Great, thank you. And is the health plan mandatory? So if a student is already covered under their parents' health insurance, do they have to sign up for the Brown health insurance plan?
No, they don't have to. They just have, the plan has to be comparable. So there's certain criteria, some of the criteria being that it provides non-emergency services while they're in the state of Rhode Island, has to be domiciled and administered in the United States, which is different than just being covered and it operates in the United States. The underwriter and the administrator have to be domiciled in the United States. And we do not accept HMOs outside of Connecticut, Rhode Island, and Massachusetts. So those are some of the criteria, but if you go to the Student Health Insurance Plan website, there's frequently asked question and list all of the criteria that need to be met by the plan in order to receive an approved waiver.
Okay, thank you. Are there co-pays for students when they go to the Health and Wellness Center?
Not when when they meet with a provider. There will be a copay if they go to the pharmacy and get a prescription. So for like the student plan, it's $15. If you have a high deductible plan, then it's whatever the cost of the prescription. So whatever your copay structure is. They would have a copay at the lab if they have a private plan, and laboratories have a copay. But for the student plan, when they go to the lab, they will not have a copay.
Okay. And say a family already has United Healthcare and their student stays with their United Healthcare plan. Does that mean that Brown is automatically within the network?
We don't bill insurance, so any provider they meet, they don't have to worry about being in network with United. It would be the pharmacy, which you would want to check with, because there are several different kinds of United Healthcare plans. It depends on what network you're on. So you would have to check that through your member portal, find a provider tool. But if you want to check the pharmacy, it's Brown Pharmacy. The laboratory will either be listed under Brown University Health Lab, or it will be listed under Miriam Hospital, because the Brown University Lab is the lab that's housed in our Health and Wellness Center, but the tests are actually processed at Miriam Hospital, and they are the ones that bill the insurance. So if Miriam Hospital is in network for your plan, then our lab is in network for your plan. But it does there's one step further, is that it processes as a hospital claim. Because some insurance plans, if you go to an independent lab that's not connected with the hospital, then it normally doesn't cost you as much. It'll have a copay or will be covered 100%. So you would have to look at your benefits to see how lab claims process in inpatient, it would say inpatient facility or outpatient facility. So that's how you would know if your student went to the Health and Wellness Lab, then you would know it would be subject to your deductible, a copay, or it would be covered 100%. That's a little
Thank you.
complicated, but
I know that gets into a lot of detail.
yes, it does, yeah. But I like to make people aware because I don't want them to just presume that it's in network.
We did get a lot of questions about health forms. Erica, do you want to talk a little bit about the system that Brown is onboarding and the timeline for students to upload their forms?
The only thing that I'm aware of is that your student will get an email when they can upload the health forms, and I apologize beyond that. I don't know anything, but they will get an email.
Yeah, and from my department, we will send out information as well to update parents and families that portal is open, but we are onboarding this new system that we hope is going to be a lot easier for folks. And so at this point in time, students can't upload any forms, but they will be getting an email very soon when they can. Let's see, what else do we have? We had another question from Canada about registered educational savings plans. And I don't know if this is Melanie or which one wants to take this, but the government requires documentation beyond the letter of admissions something that shows all of the information on the I-20 certificate, but they require it on brown letterhead. Does this kind of letter of proof of admission exist? If somebody needs, I guess, a letter on brown letterhead, would that be one of your offices or?
Yeah,
where you
I'm
should-
thinking if it's related to an educational savings plan, it is most likely my team. And I would encourage the person who posted that question to reach out to SFS, so Student Financial Services, sfs@brown.edu. And we can figure out exactly what is required and we can put together whatever's needed.
Great, thank you. Erica, there's a question about the deadline for opting in or out of the student health insurance plan. And can this be done during orientation week?
I don't, well, if orientation week is before August 29th, yes. The deadline to take action, it closes at midnight on August 29th. If
Okay,
a
well,
student-
move-in is the 27th. So that would be cutting it really, and I think orientation begins that night, so that cuts it very close.
Yeah.
Okay, but the hard deadline is August 29th.
Right.
And let's see. What other questions? We have a lot of great questions here. Erica, I think you've touched on this a little bit, but can you talk a little bit more about what the difference is between the Brown Student Health Insurance Plan and a Marketplace plan?
So Marketplace plan is a plan that an individual can go purchase themselves if they don't have access to an employer plan or a group plan. So there are 4 different tiers of insurance, and I know this is going to be a little bit long-winded, but I'll get there. So it goes platinum, which is the type of plan that we offer, gold, silver, and bronze. Even if you buy a bronze plan on the marketplace, that will warrant an approved waiver for you. So, and you can make an appointment with me to discuss this further. So say you get a rejected waiver because you have an HMO at home. You live in California and you only have emergency benefits while they're in Rhode Island, but you have an excellent HMO. So if they were to go to the emergency room, it would be covered 100%. Then I would advise, if you were comfortable, you could get a bronze plan on the marketplace with like a $5,000 deductible if you feel like your student will only go to the emergency room. Because the student plan, the marketplace plan that they will be a subscriber on will pay first. And then the plan that your plan that they're dependent on will pay second. So the benefit would be the same as if when they're home in California. But we can, if you'd like to discuss that further with me, then, make an appointment. I'll be more than happy to do so because it is a way that you can save money if you're comfortable with it. And I'll explain all the risk and everything that's involved with it.
Okay. What does the 8,100 out of pocket max mean?
That means that beyond your premium, the insurance company is not going to allow you to spend more than $8,100 during the plan year. So the way that I explain it, so the plan begins August 15th. If your student was to go to the emergency room 100 times by December 30th, well, actually 81 times by December 30th, then they will have spent $8,100. If they go to the emergency room January 15th, they will not be subject to that $100 copay, nor the $15 copay, nor any out-of-pocket costs until August 14th of 2026. So I don't know if that explains it to me. It's very simple, but you can stew around with it in your mind if that makes sense. I don't know a different way to explain it.
Okay. How long does it take to get the waiver denial once you've applied for a healthcare waiver?
It can take from 5 to 7 business days.
Okay. And let's see what else. What about non-American addresses? And this might be something that we cover next week. But if you have a non-American address, are you able to upload that into the health insurance?
No, but you can use the school address 69 Brown Street, Providence, Rhode Island, 02906. And if they don't have a US number, they can use my number, 401-863-1703. Then once the student is enrolled, they can go into their portal and their profile and they can change the address and they can update the telephone number.
And how common is it to get a waiver denial?
50% of students, a denial, how common is it?
Yeah.
I've never like looked at that number. I only know how many people waive the plan and how many people purchased it. I haven't drilled down those numbers, so I apologize. But
We'll share that with how many people usually end up waiving it.
50%. It's
So
about
50,
51.49. Yeah, 50% of people normally waive it. But if you receive a denied waiver and you feel that it's wrong, then you can reach out to me and we can always research it. Sometimes your card, the way that it's uploaded, the picture, it comes out blank. There could be different reasons. Majority of the time, the insurance broker will say you were denied because of, they will tell you the reason why you were denied. So if you don't agree with it, you can either reach out to Haler and ask questions, or you can reach out to me and we can review it to confirm that yes, the denial was correct or not. And I encourage you to do so. And that's the whole reason why I'm here. I don't manage anybody. I don't really, this is the only process I oversee. It's a very big deal for me and I like to do it. So please do reach out to me. Don't feel like you're going to be bothering me or anything, because I mean, it's about $5,000. It's a lot of money. So I understand that completely. So let's make sure that if you do have to pay it, you have to pay it.
Right. And yeah, I would encourage everybody to join us on Tuesday because we'll have a lot more detail on the health insurance plan. And if you can't join us on Tuesday, we will record it and you'll be able to watch it with plenty of time for the deadline. So we have just a few minutes left, and I want to give all the panelists a chance just to have a final word about, any top tips or, best ways to work with your office, ways parents there can support their students through this process. And then we'll close out for the day. Kier, do you want to get us started and give us some final words?
Sure thing. Thank you. I would say for us, anytime you have a question, don't hesitate to reach out to our team. You can reach us through our general email box, which is sfs@brown.edu. Our website also provides staff contact information for all of the individuals on our team. And you can also schedule a virtual appointment with us as well. So we're here to help. Any questions that you have, don't hesitate to reach out. And tell your students to check their emails.
That is so important. Great. And Melanie?
Yes, I would just echo what Kirsten said. Similar to the student financial services, we also have an appointment schedule where families can set up appointments themselves with any of our counselors. One tip I would give students for students when they're visiting the office, or parents if you're calling, it's not required, but if you know your student's banner ID number, that does help facilitate the conversation a little bit quicker. We are able to look people up by their last name, first name, but sometimes we're common names. It's a little bit easier if we have the, starting point of banner ID number, and eventually students are going to be asked that all the time, and they're going to have to know it off the top of their head, or they'll eventually learn it's like a social security number. So that's just something I would say in terms of like top tips. And then one other thing is that common confusion is that financial aid, the Office of Financial Aid, and Student Financial Services are two different offices, and we have different functions, and we often get confused with each other. And to make it even more confusing, we also have a financial advising office that has a separate that works with students separately on different things as well. So just keep that in mind. Sometimes if you're talking to us, you might be calling financial aid and talking about your bill. But we are not actually the office that manages billing and student accounts, et cetera. And same thing for Kirsten. I'm sure she probably has the same, her and her team have the same experience where you're asking questions about financial aid. We do collaborate with each other, so that's fine. But I feel like now is just a great opportunity to sort of reinforce and remind and highlight that we are actually separate offices and have different functions.
Yeah, I think that's great. And if you really don't know where to turn to, you can always email me at family@brown.edu, and I will talk to Melanie and Kirsten and figure out which one of them is gonna help you out. Before I get Erica to give her top tips, I want to put this survey link into the chat just so you can let us know your thoughts on today's presentation and help us to improve for the future. So I'm going to just leave that right here. Erica, your top tips for parents joining us.
Yeah, I don't know if it's a top tip, but it's something I do want to make you aware of. So Haler, Fryer, and Coons sends out the Take Action email every Monday morning. So it goes out weekly until the end of June. And then in the beginning of June, we'll send it 2 times a week. And then by the end of July, we will send it 3 times a week. And in August, we will send the student the Take Action email daily until they take action. So you'll want to just ask your student, did you receive that email? There are anomalies. Sometimes they don't get it, but we are definitely sending the emails to take action, and everybody has to take action. Otherwise, they're auto enrolled on September 2nd.
All right. Very important information. Thank you. I want to thank all of our panelists today, as well as our media services folks and our captioner. We appreciate all of you who joined us live today. If we didn't get to your question, please send it to me at family@brown.edu and I'll get it to where it needs to go. Thank you all for joining us. Thank you, Melanie, Kirsten, Erica. And for everyone out there, please have a great day wherever you are in the world. Take care.